Welcome back to our COVID-19 series with me, Jonathan Traylor, host of Hope with Jonathan. And this video, we will cover fever, cough and congestion, body aches and chills. And also we will be talking about fever. And if you're wondering why your body may be running a fever with COVID-19, it's the body's natural way of raising the temperature to try to give your body a fighting chance and your immune system a fighting chance. And if you notice, sometimes whenever you're sick and you end up having a fever, you start to sweat a lot. And sometimes through that sweating, you end up sweating out the sickness and virus or whatever it is that is ailing you. But a lot of times the reason why that you sweat when you have a fever, or if your body does raise its temperature and you run a higher temperature than normal, then it's your body's immune system trying to give your body, basically raising its temperature to try to give your body a fighting chance. And also, if you're wondering what an average normal body temperature is generally around 98.6. But some studies have shown that the normal body temperature can have a wide range from 97 degrees to around 99 degrees. And they sometimes call these like low grade fever. But a temperature over 100.4 is most often means that you have a fever caused by an infection or an illness. And during my COVID time that I had the Omicron for around 3 to 4 days, I did run a temperature of over 100 degrees. It was running right around 105, if you're interested at all. But hey guys, if you're wondering about more information, stay tuned to this video. We're going to cover a lot more. Hey guys, welcome back to Hope with Jonathan series here on COVID-19 Omicron symptoms. And we're going to talk about fever, cough and congestion, body aches, chills, and more. But on my last video, I thought I covered some of my symptoms, but I wanted to give a little bit more in depth. And we've already talked a little bit about running a fever. And I did run a fever probably around 3 or 4 days. It was pretty strong of a fever. If you're wondering what I took during my time of fever, we're going to cover and go into that a little more in depth on another video. But I did take over-the-counter Tylenol. And I did not take ibuprofen, and we're going to get into that type of video. So that's really going to be a great question for your team. Always consult with your team. And as a matter of fact, I'm just going to give you a verbal disclaimer. This is no way, in no shape or form, a diagnosis or any sort of prescription or remedy for any kind of COVID-19 infection or anything. This is just my personal story. This is just a video with coverage talking about my experience, my story with COVID-19 and the Omicron virus, or Omicron variant, I should say. But in no way, shape, or form, do not take my advice and say that you saw it on my video and make any changes. Please consult with a physician. Please consult with your team, your transplant team, or whoever that you need to consult with to answer any questions that you have. I'm just telling you what my team told me and my story. So now that we have that out of the way, I took Tylenol for my fever. I sweated it out. And I was hydrating, and I'm gonna do a video on the importance of hydration as well. But I was hydrating like crazy, and I was just really drinking. I talked about this in the last video. I was eating, I was snacking. I had this just just craving for just kept wanting to nibble on something, just have something, eat something. And I began to do that, and I was eating like crackers and things like that, and peanut butter crackers and peanuts and things like that. It's something I could just crunch on and kind of nibble on and trying to eat and feed my body. My body just felt like I needed some nutrients. I was eating some fruit. I was eating like bananas and things like that. But yet you have to watch all that stuff because of potassium. And I am a transplant recipient, but I am still mindful of like potassiums and sodium and all that stuff. So I have to keep a lot of that stuff, in mind and be mindful of all those things whenever you're trying to battle a virus, even though you're trying to boost your immune system. Then, of course, we're going to talk a little bit about, I'm going to do a video covering, immune compromised bodies, because when you're immune compromised, your body really doesn't stand a fighting chance really against infection while you're taking these immune compromised medications. So it's kind of a tough battle, and that's why the fear of getting COVID is such a fear and gives everyone such anxiety because of this, that are transplant recipients and immune compromised patients. Across the board, it's a very scary virus it's a scary thing to encounter and end up with COVID-19, no matter which variant you get or no matter which strain you get. But let's talk a little bit about cough and congestion. So I also had severe cough and congestion. Did not start my first night, which was around a Sunday. By like Tuesday, I had a severe cough. I mean, I was coughing and coughing and coughing. And if you wonder what I was doing to remedy the cough, was I taking crazy amounts of cough medicine or cough suppressants? No, I was not. Ultimately, my team was pretty much telling me, because there was no monoclonal antibodies available, things like this for me. Basically, I had to tough it out at home, and they really didn't give me a prescription for anything. There was no like Z-Pack given to me or anything like that. They finally told me, after a couple of phone calls to them, that I could take Coricidin, which was safe for me because of diabetes and hypertension. They were really concerned about hypertension, and although I'm not really suffering too bad with hypertension, I am actually free of all high blood pressure medications due to my kidney transplant. It's an amazing thing that happened to me, because I was on 3 different blood pressure medications during dialysis. And they dwindled me down finally to 1 after I went on home hemodialysis. And then once I switched over and finally got the gift of life and got transplanted, my kidney just basically controlled my blood pressure. And it's just been incredible. Of course, I'm following a strict diet. I'm exercising and things like that. So those 2 factors really help. Being mindful of sodium is a huge factor. So those things have helped control my blood pressure. But needless to say, the cough and congestion was severe, probably for around about the same time of the fever. It was around 3 or 4 days. And I even had a slight cough. I'm post now, if you're wondering during this video, I'm now post COVID, probably around 4 weeks. So about a month ago. This Sunday actually will be a month that I've had the COVID virus with the Omicron variant. And I'm about a month post. And I'll be honest with you, this week is when I finally noticed that my cough has really went away. I mean, for like probably 2 weeks, I still had a slight cough where I was just really kind of hacking and just, almost like you breathed in something and you had like an allergy. That was pretty much what I had. And also I had congestion. So I had severe congestion. When I say severe congestion, it was almost like a sinus infection. I had gunk just coming out of my chest. I'm just giving you I'm just giving you the real here. I had congestion come out, out of my chest. I had congestion in my upper sinus cavities and in here, my nasal passages. I mean, I was really, really congested with a lot of gunk and fluids. And I was really trying to be mindful of it, not to let it get too out of control. Again, I was told to take Corsetin. Corsetin was pretty much all I was taking to helpful. And it was basically like taking NyQuil, only it wasn't NyQuil, it was Corsetin. And so it didn't really make me sleepy. I mean, it had acetaminophen in it. It didn't really make me too sleepy or give you that, like kind of woozy feeling. But it did seem to help, and it did seem to help control the cough and congestion for a while. And then, of course, at nighttime, I had to take another dose. So I think it was like every 4 to 6 hours I was taking that. The next thing I wanted to cover and talk a little bit about was body aches and chills. So, of course, when you're running a fever, at nighttime, especially, I could tell when it was starting to hit. I would get cold. I started feeling these feverish, like chills, kind of like just kind of a tremble in my body, kind of shaky. The body aches was kind of like just a tiredness and like a soreness, dull ache, like sort of in my, up in my upper back, my upper shoulders, my neck area, my joints and my knees and my legs and my hips. Just felt kind of overall really, really achy. Just overall, just did not feel well at all. Just really had this sense of overwhelming achiness, and the Tylenol seemed to help with that, and also the Corsetin did help with the cough and stuff. Like I said, the Corsetin had a little bit of acetaminophen, so that would help a little bit with the body aches and the chills. But I did have a sense of soreness. That lasted for probably about 3 or 4 days as well. So, if in case you guys are just wondering what exactly did I do during the course of time, like I said, I was on the couch. I was in here watching TV. I would get on my phone here and there, but that would get old. So I was watching like Netflix, and then I would just pass out, and then I'd get back up and I would eat something, make sure I'm drinking in between my sleep spells and or my sleep sessions, I should say. And then I would take more medication, get dope back up, and then go back and lay back down, watch some more TV. Excuse me. And that was pretty much the routine. If you're also wondering, like, well, when did you start to feel better? And I'm going to do a video on that as well. But I really didn't start to feel better. If you're just wondering, it's probably around day 4, day 5. I forced myself literally to get up off the couch after being real sedentary and not doing much and not moving much around the house. I mean, just enough to get up and go to the kitchen, or enough to go to the table to like do all my, check my blood sugar and check my blood pressure and do all my medications and stuff like that. And then enough to get to the bathroom and then back to the couch or back to the bed. That was pretty much my routine for like 4 or 5 days. But like on day 4 or 5, I decided I was getting out of the house, and I went out. I was all masked up. No one was around me. And I went for a walk for about an hour and a half, maybe. And I mean, I was gone, and I walked a slow pace, but I did about a mile and mile and a half, and I felt really well. Now, normally, I can do a mile and a half in like 30 minutes, maybe, but it took me like an hour to do that. But I felt so much better to just get that blood circulating in me, some fresh air in my lungs, and I probably could have done more if I wanted to, but I didn't want to push it. And I got to tell you, that was sort of a breaking point and a breaking moment for me whenever I was fighting this virus, was that I needed to get out and get some blood circulation, some fresh air in my lungs, and things like that. And that really helped me get over sort of the hump of this, where I was, in between, getting sort of feeling a little bit better, but still just really sick. And I really, truly believe that was kind of a defining moment in this fight of COVID. And like I said, after day 5, the fever had finally went away. I was in, if you're wondering, I was in contact with my team every day. I was calling them, staying in contact with them, telling them what was going on, being engaged with, my whole team staff, including my primary my transplant team, transplant coordinator, all that stuff. I was in contact with them at all times, and they knew what was going on. You know, it was just incredible for me because my local hospital here was out of the monoclonal antibodies infusion, and also my transplant facility, which I was transplanted in San Antonio, which is a large city. So it was really tough. I mean, if they don't have it, then who has it? And in this area of Texas, so it's incredible. My transplant facility does like thousands of transplants a year. So I mean, I'm guessing that there was a shortage pretty much everywhere because I've seen a lot of people saying at that point in time that there was just not enough of these infusions around. And so it was scary. It was a scary time looking back just a couple of weeks ago. I mean, I was really nervous. I wasn't sure exactly what was going to happen. I was just praying to God every night that, and every day, like, God, please don't let me get on a ventilator. Please don't let me get, really bad with this. And it was really scary. And I want to do a video on this as well. I don't want to talk about it too much. I want to kind of leave these kind of short, but they did have me reduce my CellCept, my medication for immunosuppressants. My CellCept, they had me reduce it to one a day. So I normally take 3 a day. I take around 750 milligram, and so they reduced me down to the 250. And they said that this would not hurt my kidney. They wanted me to do this for 5 days, and they said this would not hurt my kidney at all. That they wanted me to reduce it to kind of up my immune system and give me more of a fighting chance. And again, I'm going to expand on this a little bit more into the series. Again, this is no way, shape, or form a prescription or diagnosis. So like I said, I was just following my team's orders and following what my nephrologist and my team told me to do. But I wanted to talk to you guys a little bit about my symptoms. I think it's important for me to talk about my symptoms. As you guys can see, I'm doing a lot better. I sound a lot better. I sound a lot clearer, and that's because the cough has gone away. The drainage has really gone away, and I feel incredible. I haven't ran a fever for like weeks now, and just feeling lots better. My body aches and chills, they've gone away as well. So, you say, well, what's helped you? Again, we're going to just cover it real quickly. What really helped me was staying engaged with my team, number one, taking the medications that was told to me, prescribed to me or told to me that was safe for me to take, which was Tylenol for the fever, Quercetin. I was able to take Quercetin. It was kind of hard to find. I did pay a little bit of money for it. It was like $10 for that bottle of Quercetin. And then also getting out and getting some exercise and walking and getting some fresh air in my lungs, the blood circulation and all that stuff. It just seemed like that's what really catapulted me out of this and got me feeling a lot better. Sitting around the house, staying sedentary, just kind of, just moping around the house. And yes, I was sick. I did not feel well, did not have very much strength, but I forced myself to get out. And I'm telling you, it worked wonders for me. I felt so much better just getting back out. And now I'm back into my normal routine where I'm walking all the time, and I'm actually still available at my local gym. I'm able to go there at nighttime when there's hardly anybody, if anybody there at all. Still wear my mask, and I'm really mindful of what I'm doing in there. But I feel like I'm really probably around 99% back. But if you guys are wondering more about my story, stay tuned for these more videos. Stay engaged with your team. And definitely, if you have any symptoms at all of COVID, I mean, if you're leery, I have many family members at this moment. I can count on my hand 3 or 4 or 5 of them that have, had these similar symptoms, and they procrastinated and waited, and now they're finding out finally, oh yeah, I'm positive for COVID, because they finally went and bought a test, or they finally got sick enough, ended up at the emergency room and find out, yes, they're positive. So if you're fighting any of these symptoms at all, I mean, you feel like you got seasonal allergies or an itchy throat, or you feel just like a common cold symptom, or maybe even like felt like you're fighting the flu. There's other side effects and symptoms and things like that. I mean, diarrhea is one of them. Hiccups is another one. I'm not saying that you have it, but it's worth to go get checked out if you feel like you got any of those symptoms at all, especially if you're running a fever with any of these symptoms, cough and congestion, just not feeling right. It's a complete. It's worth your time. It's worth your time to go get checked out. Okay, guys, especially if you're immune compromised or if you're a transplant recipient, just like I am. Well, hey guys, again, this is Jonathan. I hope these videos are going to help you guys out. I'm going to continue to do these little, COVID videos to give you guys some insight on my story with battling COVID-19, the Omicron variant. Guys, I hope you guys take care. Stay safe out there. And remember to take care of your kidneys. God bless you guys.
Hope with Jonathan is created as an informational, educational, and entertainment show. Hope with Jonathan hosts, guests, partners provide information on the basis of research and personal experiences, and is not to be taken as or implied as diagnosis of any disease or treatment. Hope with Jonathan, its host and guests and partners, recommend and encourage you to speak to your medical team before implementing any treatment or diagnosis found on this show or any product, service associated to Hope with Jonathan.